Here's a clear, science-based, audience-friendly script in English, written in a continuous narrative with no headings, designed for a Health Channel voiceover in the style of a calm, trustworthy physician. It uses plain language, avoids sensationalism, and focuses on safety, consent, and comfort. If you've ever thought, anal sex just hurts, so it's not for me, that reaction is more common than you think, and it's not a sign that your body is broken. It's usually a sign that nobody ever taught you how the body actually works, or how to prepare properly. Today, I'm going to walk you through 5 keys to make anal sex more comfortable and, for many people, genuinely enjoyable, without pain and without fear. This is educational content, not personal medical advice, and it applies to adults in consensual relationships regardless of gender or orientation. The goal here is simple: informed choice, better communication, and fewer injuries. The first key is mindset and consent. Pain-free anal sex begins long before any physical contact. Your nervous system is the gatekeeper for comfort. When you feel rushed, pressured, or judged, your brain sends a protest signal that tightens the pelvic floor and anal sphincters. That tension alone can turn even gentle touch into burning or stinging. Start by deciding together that comfort is the priority and that pleasure only counts if it's truly consensual. Agree on a pause word and a stop word. Pause means freeze in place to breathe and reassess. Stop means everything ends immediately with no negotiation. Replace performance goals with process goals. You're not trying to achieve penetration at all costs. You're exploring sensations and stopping at the first sign of pain. When your brain trusts that you will stop, your body stops guarding and everything gets easier. Normalize going slow, normalize trying again another day, and normalize that pleasure can happen with or without penetration. Only proceed on a day when you feel rested, emotionally safe, and not in a rush. If there's resentment, pressure, or a deadline, the pelvic floor will tell the truth even if your words say yes. The second key is anatomy, lubrication, and barriers. The anus is designed to open and close for bowel movements, not to self-lubricate like the vagina. That means comfort depends on how you work with the 2 sphincters and how much lube you use. There's an external ring you can feel at the entrance and an internal ring a little deeper. Both need time to relax. Start with lots of lubrication, more than you think. Water-based lubes are easy to clean and safe with condoms and toys. Silicone-based lubes last longer and can be excellent for anal play, but they can degrade some silicone toys. Avoid oils with latex condoms because oil weakens latex, and avoid numbing creams because they hide pain, which is the body's protective feedback. Trim nails, remove rings, and consider a nitrile or latex glove for fingers. It's hygienic, slick with lube, and reduces scratch risk. Use condoms on toys and during penis and anus sex, and always change to a fresh condom before switching to any vaginal or oral contact. That simple habit prevents bacteria transfer and lowers STI risk. Hygiene matters, but you don't need harsh enemas. A warm shower and a gentle, small volume rinse, if you choose to rinse at all, is enough for most people. Avoid large or forceful enemas that can irritate the lining. Eat and hydrate normally. Extremely restrictive prep routines are neither necessary nor helpful for comfort. The third key is progressive warm-up and pacing. Comfort comes from gradual dilation and accurate feedback, not from gritting your teeth. Begin externally with touch that tells the nervous system you're safe. Warm hands, relaxed breathing, and gentle pressure around the entrance can melt the guarding reflex. If you use a finger, keep it well lubed. Start with the soft pad of the finger and pause at the entrance to let the external sphincter feel the shape. Think hover and breathe before enter. When you and your partner are in sync, add minimal pressure during an exhale or during a gentle bear down, like the beginning of a bowel movement. That action lengthens and relaxes the pelvic floor, so entry feels like it's happening with your body, not to your body. Once the first knuckle is comfortable, stop there and wait. Let stretching become sensation, not pain. Breathe low into the belly, unclench the jaw, and keep shoulders soft. Jaw tension and anal tension are often linked. Build up slowly, one finger, then maybe two, then a small flared base plug designed for anal use, never anything without a base. The base matters because the rectum can swallow objects that are hard to retrieve. If you use toys, choose beginner sizes. A toy that looks cute can still be too large. Pain is not a toll you pay to get to pleasure, it's a stop sign. Sharp, burning pain means back up, add more lube, decrease size, or try another day. When moving from fingers or a small plug to a larger toy or a penis, think in micro steps, not leaps. Entry should be the slowest part, with pauses that allow the internal sphincter to adapt. Many people find that angling slightly toward the tailbone rather than straight up reduces the sensation of hitting a wall. Gentle rocking or tiny circles can feel better than pushing forward. If at any point the receiver loses relaxation, go back a step. The body is not a lock you force open, it's a door that opens when the hinges are warm. The fourth key is pelvic floor function and positioning. A relaxed pelvic floor is the secret ingredient most people never hear about. The pelvic floor isn't just about strength, it's about coordination, being able to both contract and let go. If your baseline is tight from stress, sitting all day, or previous painful experiences, you need more relaxation practice than strength work. Before any play, try a hot shower or a warm bath to increase blood flow. Practice slow nasal breathing with long exhales. Imagine the pelvic floor dropping on the exhale like a flower opening. That's a reverse Kegel, learning the let go, not a squeeze. Some people benefit from a brief sequence, 3 easy belly breaths, a slow 360-degree inhale into the ribs and low back, then a long sigh out while the belly softens. Add gentle hip openers on the floor, knees falling together and apart, figure 4 stretch, or lying on your side with a pillow between the knees. If you have a history of pain, hemorrhoids, fissures, or pelvic trauma, consider a session with a pelvic floor physical therapist for individualized guidance. Learning to sense tension patterns can be life-changing. Positioning matters because it changes the angle and the amount of muscle work required. Side-lying with knees slightly bent can feel more relaxed and controllable than positions that put pressure on the low back. Many receivers prefer to control the depth and speed. Being on top or guiding the angle with a hand can help. Pillows under the hips can change the angle just enough to remove the pinch feeling. Communication is a technique, not an accessory. Say, hold there, slower, back a little, or stay at this depth. Short, specific instructions keep the nervous system calm and reduce guesswork. The fifth key is timing, aftercare, and red flags. Choose a time when you're not rushed and when you won't need to rush to the bathroom or jump into a meeting 15 minutes later. Have a towel, wipes, extra lube, and a spare condom within reach so you don't break the flow searching for supplies. Eat normally that day. Extreme fasting or last-minute fiber pills can backfire. Afterward, check in physically and emotionally. A warm shower, a gentle rinse if you like, breathable underwear, and a small amount of a plain barrier ointment around the entrance can soothe minor irritation. Hydrate and consider a fiber-rich snack later to keep bowel movements soft. Mild soreness can happen the first few times, but sharp pain, bleeding more than a streak, fever, or worsening pain are red flags. Seek medical assessment if anything feels off. If you have active hemorrhoids, a fissure, prostatitis, a pelvic infection, uncontrolled inflammatory bowel disease, or you're recovering from rectal or pelvic surgery, postpone and ask your clinician for guidance. Avoid switching from anal to vaginal or oral contact without changing condoms or washing thoroughly. That step prevents bacterial transfer. If you're using toys, clean them according to the manufacturer's instructions. If they're porous or shared, use condoms on them. If you're sexually active with partners whose STI status you don't know, use condoms consistently. Anal sex carries risk for STI transmission, and barriers are part of pain prevention because infections can make tissues fragile. Now let's put those 5 keys together so they feel practical. Imagine a session that starts with agreement, comfort first, stop words ready, and a mutual understanding that nothing has to happen. You or your partner take a warm shower, you set out lube, condoms, and a small beginner-friendly plug or nothing at all if you're just exploring. You spend a few minutes with slow breathing, maybe lying on your side, letting the belly soften. Touch begins externally, no urgency, no goal, because the goal is nervous system safety. You add lube generously, test at the entrance with a fingertip pad, pause, breathe out, and let your body tell you if it wants a little more. If the sensation is more than you want, you stop and switch to something that feels good. If it's okay, you stay shallow, let sensation settle, and only then consider more depth. If you move forward to a toy or a penis, you keep the angle gentle, you guide the pace, and you treat every sign of tension as information, not a challenge. You never use numbing creams because you want to feel what you're doing. If something is pokey or pinchy, you don't push through. You back up, add lube, change the angle, or call it for the day. You treat your body like a conversation partner, not a project. There are a few common myths that quietly sabotage comfort, so let's clear them. Myth 1, if it hurts, you just need to relax more. Reality, pain means something specific is off. Size, speed, angle, inadequate lube, tension, inflammation, or a medical issue. Respect the signal and troubleshoot. Don't ignore it. Myth 2, bigger is better. Reality, tissues adapt gradually. Most people are comfortable with small to moderate sizes and never need to go larger. Bigger can be fine for some, but it's never a requirement for pleasure. Myth 3, cleaning has to be extreme. Reality, harsh enemas irritate, gentle routines work best. Myth 4, numbing creams are your friend. Reality, they remove the feedback loop that keeps you safe. Myth 5, once you get it, you can always go fast. Reality, bodies vary day to day. What felt great last Saturday may need more warm-up this Wednesday. Taking time is not a setback, it's skill. If you've tried before and it hurt, there are compassionate ways to reset. Give yourself a few weeks with no penetrative anal play at all. Focus on pelvic floor relaxation and gentle external touch, and let your nervous system stop associating anal stimulation with guard. When you reintroduce penetration, start smaller than you think, use even more lube than before, and keep the session short and successful. End on comfort, not on endurance. If discomfort is persistent, even with careful technique, talk to a clinician who is truly sex positive and pelvic floor literate. Issues like pelvic floor hypertonicity, fissures, hemorrhoids, and dermatologic conditions are treatable, and treating them can change everything. Let's talk about partners and communication, because many painful experiences begin with misaligned expectations. If you're the penetrating partner, your job is to follow, not lead. Think of yourself as a guest, not a battering ram. Ask real-time questions that are easy to answer. Is this pressure okay? Do you want more of this or less? Stay or back off. Learn to hold still and let the receiver move. If you're the receiving partner and you're trying to please someone else at your own expense, remember that consent includes comfort, and comfort includes control. You can be generous and loving without hurting yourself. The more honest you are about what you feel, the better your partner can be. The more you practice describing sensations, too sharp, pressure is fine but not stretch, angle feels off, the more precisely you can adjust. Good communication turns a risky guess into a collaborative process, and collaboration is the shortest route to pleasure. There are also life context factors worth mentioning because they change the baseline of the pelvic floor. High stress, poor sleep, dehydration, and long hours of sitting all increase muscle tone and reduce tissue glide. On days like that, expect to need more warm-up or to skip penetration entirely. A little movement earlier in the day, walking, hip circles, gentle squats, can improve blood flow and tissue elasticity. Staying hydrated and keeping bowel movements soft with a fiber-rich diet reduces the chance of straining, which reduces the risk of fissures that make any anal contact painful. If you're dealing with recurrent rectal pain, bleeding, or bowel changes, get that evaluated. You deserve clarity. If you're postpartum, healing from surgery, or have active inflammatory bowel disease, tailor your choices with your healthcare team. Finally, remember why you're learning these keys in the first place. Pleasure is a full-body, full-mind experience, and unhurried exploration makes room for both. There is nothing immature about needing lube, nothing weak about stopping, and nothing strange about preferring shallow sensation over deep penetration or vice versa. There's also nothing wrong with deciding that anal sex isn't for you. The most empowered choice is the one that's informed, comfortable, and aligned with your values. If you do choose to explore, bring patience, bring curiosity, and bring the agreement that pain is not part of the plan. With consent as your foundation, anatomy and lube as your tools, progressive warm-up as your method, pelvic relaxation, and good positioning as your technique, and thoughtful aftercare as your closing chapter, you'll have what most people never got: a simple, science-based strategy for anal sex without pain. If this helped, save it and revisit it before your next session so the steps feel familiar. If you want a version tailored for a specific audience, male, female, mixed couples, or solo play, I can adapt the language while keeping the same safety principles. And if you need a shorter version for a quick social clip, I can compress the essentials into a 1-minute voiceover without losing the core message.